Osteoporosis is a systemic skeletal disease characterized by long bone mass and small areas of deterioration of bone tissue, with a consequent increase in bone fragility and susceptibility to fracture. The risk of fractures is higher in elderly individuals with poor working balance and vision. Some risk factors include parental hip fractures, advanced age, especially women after menopause, smoking, alcohol abuse, immobilization, inadequate intake of vitamin D and calcium, prolonged steroid use, hyperthyroidism, hyperparathyroidism, type 1 diabetes mellitus, rheumatoid arthritis, malabsorption syndromes, and low femoral neck bone mineral density, as BMD. The causes are imbalance between new bone formation and old bone breakdown. So there is bone mineral loss and also low bone density. The symptoms are back pain, inability to walk after a very trivial fall. And the signs that are usually elicited are deformed limbs, fractures, stooping stance. Investigations are X-ray of wrists or hips, bone mineral density scan, that's BMD scan, and quantitative CT scan. The treatment objectives are management of underlying risk factors, prevention of fractures, early treatment of fractures, non-pharmacological treatment, dietary, inadequate intake of calcium and vitamin D containing foods, therapeutic lifestyle changes. Pharmacological treatment for low fracture risk. First line treatment, we give calcium with vitamin D oral. In adults, 1000 to 1300 milligrams daily of calcium and 200 to 800 IU vitamin D daily. For moderate fracture risk, you give calcium with vitamin D oral. In adults, 1000 to 1500 milligrams daily of calcium and 200 to 800 IU vitamin D daily. For high fracture risk, you need bone replacement therapy, that's HRT, estrogen therapy, that's AT, bisphosphonates, calcitonin, you give calcitonin, selective estrogen receptor modulators, denosumab, and strontium or teriparatide. These are what you do for high risk fracture. For any of the therapies, you have to consult a specialist. Referral criteria: refer all cases to a physician or orthopedic specialist.